All right, this is Dr. Jeffrey Gerdes, your Raleigh, North Carolina chiropractor at Carolina ChiroCare and Rehab. And we are here today with Michael Lucas. And Michael is a R&B singer. Tell us a little bit about that.
Yeah, well, I've been doing music for a while, since about 2014 when I graduated. Me and my brother were an R&B group. Tragically, he passed away, and I've just been, carrying on the passion and the mission. Since then, I moved out here in North Carolina. And yeah, it's been a blessing. My music I go by the handle Mike Lucas on iTunes and Spotify and stuff like that. Not my full name, Michael Lucas. It's Mike Lucas, so it's like.
Okay. And you perform here locally, and you do some traveling too. Every time we see you, kind of going back and forth between Atlanta you're trying to sign a record deal, is that right?
Yeah, we've been, I'm independent, so we've been in negotiation with different record labels like Epic Records or Universal, throughout New York and Atlanta. We really want to touch the Motown feeling, and when you look my music up, you'll catch the vibe. It's good music. Yeah.
Make sure to check in the link below in the description. We're going to put a link to your iTunes page and your Instagram account. If you want to download some of the songs, there'll be some links in the description part below. So, Michael, tell us a little bit about what brought you into our office and how you found us.
Well, I was recommended by my aunt, but we were in an accident. My uncle and I were driving our E350 Benz, and a Ram truck came from behind us and going pretty fast and slammed into the left side of the rear, so the driver rear side. And at that time, I was in the passenger seat and, talking to my uncle, and we just, boom. And the car kind of lost control. I got real, out of balance, I should say, and just was feeling real pain in my back and in my neck and shoulder area. And we rested the first night, went to the hospital that morning. And then, yeah, we found Carolina ChiroCare.
And since you've been coming here, you've been feeling some good pain relief. You're better. It's been about 5 or 6 weeks. He's been getting some improvements. The pain is still there, and we've gotten him to a point now after the treatment, for 2-3 days, you're feeling pretty good, and then it kind of slowly comes back a little, but you're on your way to recovery, and so far with the chiropractic, you feel like it's really helped you a lot?
It definitely has, I've been out of shape for the last couple of months, but I just got back into balling, and I feel better. It gets tighter, like I told him the last time, it gets a little tight, and I get tense. But when I leave here, I feel relief, and it's definitely a lovely feeling, like I'm getting back to normal. So.
Good. Sounds like we're pretty close. So, all right, so now we're gonna proceed with the treatment on Mike. Mike, can you lay face down here?
Yes, sir.
So we can go in, we can feel where the joints are not moving correctly, we can feel the muscle spasms. Much of his pain today is located in the lower thoracic spine, upper lumbar spine, T12 through L1. You can feel here the muscles on the left are spastic and hypertonic. And this is where you're having some of your back pain, is that correct?
Yeah, that's the majority of it.
And they also have some shoulder pain. He sprained his rotator cuff during the accident. That's a common injury that we see, is a rotator cuff sprain. And let's see, we're gonna lay face up, please. So we're gonna go right into the cervical vertebrae, palpate where the areas of dysfunction are, and where he's complaining of some of his symptoms. get your mid back. Now we're going to adjust this thoracic vertebrae. And now we're going to adjust and mobilize his lumbar vertebrae and his sacroiliac joints. Can you lay here on your side, please? Side. That feels pretty good on your back, is that right?
Yeah.
Feel right here. The sacroiliac joint a little higher at L5 where the dysfunction is. Great. Let's lay face down again. Okay, so we just adjusted Mike's spine. Now we're gonna go into the soft tissues that were injured during the accident and the fascia, and we're going to do myofascial manual therapy on the areas where he continues to have muscle spasms, tightness, a little numbness, and some pain too. Alright, now we're going to work on some rehab for Mike's shoulder. We're going to do some rotator strengthening while I go underneath his shoulder blade and work on some of the knots that have built up with the hyperized therapy. So we'll go ahead and we're going to do abduction, external rotation. Alright, so we just completed Mike's chiropractic treatment. How do you feel?
I feel good.
Good. And so
relaxed.
Good. Alright, thanks for watching. Dr. Jeffrey Gerdes, Carolina ChiroCare and Rehab. Until next time.